Member for Wakehurst.
Thank you, Speaker. My question is to the Chair of the Public Accounts Committee. Can you update the House on the progress of the inquiry into the safety and quality of health services provided by Northern Beaches Hospital?
In that case, I shall call the Chair of the Public Accounts Committee, Member for Strathfield.
Thanks, Mr. Speaker. I thank the member for Wakehurst for his question. He is an absolute champion for his community on the Northern Beaches, agitated for the performance audit into the Northern Beaches Hospital. And I'm sure that his question is motivated by the need of his community to know what went wrong. How did it go so bad? As well as looking forward, some reassurance that their healthcare needs will be met to the level of quality that every resident of New South Wales deserves. Mr. Speaker, I can report to the House that the PAC has received 255 submissions and conducted 3 days of hearings, and we're working through that evidence right now. Mr. Speaker, it's a complex and challenging inquiry for two main reasons. Firstly, the majority of the submissions we received were confidential, and much of the evidence in the hearings was taken in camera, which means we can't refer to them in our findings or our report. The second reason is because we are well aware that there is an ongoing coronial inquest into the tragic death of Joe Massa. And the last thing that we want is for our inquiry to in any way compromise or prejudice that inquest or any potential future criminal or civil proceedings. And so we've been very careful to stay away from any clinical evidence or any attribution of responsibility. Instead, we're focused on the policy and the systemic issues. Mr. Speaker, it wouldn't be appropriate for me to comment on the deliberations of the committee or to preempt any of the findings. I would, however, like to quote from some of the public evidence and material that's available now on the committee's website. Sworn evidence from Associate Professor Patricia Huller, Director of Adult Medicine and member of the Medical Advisory Committee of Northern Beaches Hospital. Can I just acknowledge that we weren't set up to succeed for the patients of the Northern Beaches, but we're doctors and we're clinicians, and where we saw deficiencies, we worked to fill them. Sworn evidence of Prue Irvine, Organiser Health Services Union. Yes, I think they cut staff. The security team went from, I think, having 5 people on shift to 3, which put our members at a lot of risk of harm. Sworn evidence of Dr. Tatiana Lowe, Staff Specialist MBH, and Australian Salaried Medical Officers Federation. The Australasian College for Emergency Medicine recommends that we should roster 32 to 40 doctors per 24 hours. We routinely have 30, and, as I've said, operate 3 to 9 doctors lower than that. We should have 4 to 5 consultants per shift. We routinely have 3.
Member for Strathfield. Member for Wakehurst.
I seek an extension of time.
An additional 2 minutes is granted. Member for Strathfield.
We should roster 8 doctors on a night shift. We routinely have 5. Working under those circumstances just means the risk inevitably is higher on all shifts. Sworn evidence again of Associate Professor Patricia Huller. The lack of integration and the electronic medical record system has been really challenging. A lot of our patients move between different service providers in the LHD. Monavale Hospital is public, and we can't see what's happening there because our EMRs aren't aligned. Sworn evidence from Adjunct Professor Anthony Shembry, Chief Executive of Northern Sydney Local Health District. I think there are many opportunities. The opportunity to fully integrate the Northern Beaches into Northern Sydney's clinical networks, to integrate the hospital in line with our workforce priorities and staffing, such as nursing hours per patient day for our nurses and the opportunities to bring clinical trials in a way that previously the community may not have had access to. And finally, Dr. David Jollo, Director of Women's Health and member of the Medical Advisory Committee. We support the decision to return many services to the public hospital system. This needs to include how our community continues to access high-quality public services as well as high-quality private services. Mr. Speaker, when you boil it all down, essentially what we had at Northern Beaches Hospital was a public hospital, including a public emergency department that was put in the hands of a foreign private equity firm. Mr. Speaker, what could possibly go wrong? And I note the Minns Labor government has passed Joe's laws so that hopefully never again will we have the privatisation of acute health services. I want to thank everybody who has contributed to the inquiry so far, particularly the witnesses. I want to acknowledge the work of the Health Minister and the Treasurer and their teams doing the very difficult work of unpacking this very complex commercial arrangement to return it to public hands without there being an unconscionable bill for New South Wales taxpayers. And I acknowledge the member for Wakehurst for his outstanding activity.